Hello and welcome to another edition of Personal Health and Fitness. I'm your host, Chad Marshall. Today I'm at Physiotherapy Professionals here in Springfield, which is a local physical therapy organization. I want to introduce both Leah Benty-Holcher and Bridget Cutler. And I've known both for quite a long time, and they've helped me personally, and also a lot of the clients that we send from Body Symmetry experience phenomenal results. Why don't you guys tell me about your new business?
Well, we opened basically in May of last year, so we've been open for 1 year. We both have had a lot of experience in outpatient physical therapy in Springfield. Both of us used to work at Athletic Care St. John's, and Leah used to work at Memorial. So we decided to go out on our own and start a private practice so that we could focus more on things that we are interested in, as opposed to, having such a big location and worrying about, patients, getting them in and out. We wanted to spend more time, one-on-one time with our patients.
And you both have your doctorates in physical therapy, which there aren't actually too many doctorate and PTs out there. I know that you went to WashU and you went to SLU, and Bridget, you're originally from New Zealand. What is the difference between a physical therapist and a physiotherapist? I know you guys have a unique name, and I've often wondered that.
Physiotherapy is basically the term that they call physical therapists everywhere else in the world except the United States. And since I come from New Zealand, we thought it would be kind of a nice play on words. In England, South Africa, everywhere else, all over the world, basically, physical therapists are called physiotherapists.
Right.
And that was what they were originally called. But it got changed in this country for reasons that I don't know. So we just decided to have a play on words and,
I like the name. I know during this segment of the show we're going to be talking about neck pain, and the second segment we're going to be talking about balance. It seems like everybody encounters neck pain at one time or another in their life. Let's talk about that. What are you going to show us today?
It does seem that everyone has some type of neck pain. It's often due to sitting on the computers all day. America has become much more sedentary than we once were. So posture is a big reason that we have neck pain, and we're going to get into the reasons and the other parts of the spine that also play into neck pain.
Okay, well, let's talk about it. What are we going to do first?
I'm going to have Bridget sit down right here. Which way? I want you to face that way. One thing I want to say about neck pain is a lot of times we are stiff in our thoracic spine through here because of sitting posture, like Bridget's sitting right now.
everybody sits like this.
Really?
Yes.
Especially my 15-year-old son.
Yes. So often we will have people start, let's use a lumbar roll, because if I straighten you up here, that's going to follow all the way up the spine to better align you. We add into sitting here and put your hands out on the computer, and as we get older, our vision gets bad and they start looking closer at the screen. So we also have to deal with the forward head often. So what happens sometimes too is we'll get too much movement, possibly in the middle of the spine. Everybody's a little bit different where we might move too much, but maybe this person is moving too much in the middle of the spine, and the upper part of the spine gets tight. Or maybe it's purely thoracic spine. Sometimes people also get a joint that just becomes tight in one area. So we have to really break down from top to bottom to figure out what's going on.
So how does that affect the muscles in the neck and the back when you're talking about the spine and the joints? Talk about that.
The different muscles that should be at one length will get too short or too long is what will basically happen.
Okay.
So a lot of times, along with treating the neck, actually all the time, I will address the strength in these muscles, because if we can get the lumbar spine to behave, we've also got to get these lower scapular muscles to get strong, which may not help you a ton just sitting there, but it's going to help you in your everyday things, activities that you do.
Right.
And the other thing is you get shortening in the upper cervical muscles here and shortening in the pecs. So you're fighting against tight muscles in the front.
And those shoulders round as well, typically.
So you're fighting, you've got tight in the front and weak in the back, typically.
What will play along with that too is we'll get a lot of people that come in with pain in between the shoulder blades. And exactly what Bridget said, a lot of people will come in with just pain in here. And so once again, we got to get these shoulder blades moving, and sometimes the ribs will get tight and we have to get the ribs moving.
Right.
The big thing that I think that we see a lot of
Mm-hmm.
are people that come in and they're too far gone.
Right.
They're structurally changed because they've been sitting like this for too long.
In essence, they've become fused.
Yeah, and everybody has neck pain, so why not address it before it becomes a
Right.
debilitating problem where you can't actually fix it, where it's a lot harder to fix.
Well, what are some of the red flags? I mean, what are some of the things that people should be, looking for in their own body? I have a surprisingly a high level of pain tolerance, so I don't really notice things so well. But sometimes structurally, maybe with movement, I notice that I'm not moving as well. So talk about the difference between pain and range of motion and how that's different and what you need to look for.
Well, typically, when you're looking at cervical spine range of motion, most people, when they look up, should be able to get their face close to parallel to the roof.
Okay.
And you'll find a lot of people, when they're sitting like this, you try and look up, look where my face is, it's not anywhere near the roof.
They've lost about
Okay, so that's the
80%
first thing. And you're going to notice it if you're backing the car and you're not able to turn around and see very well, things
Right.
like that. If you're just getting a lot of headaches, if you're getting aching pain in here,
Okay.
and it's not pain that's bad enough that you're going to like run off and see a physical therapist, but actually that's probably the time you need to go, because
Right.
those are the signs that something's not right in there, and there could be some simple exercises which Leah and I are going to show you that you can do to just combat that.
Okay, great. Let's talk about some of those simple exercises.
The first exercise that we may often give for neck pain is retraction. Retraction is just bringing the chin backwards. Sometimes we'll call it a chin tuck, but we have to be careful calling it a chin tuck because sometimes people think about bending the head forward.
Right.
Our head is forward enough during the day that often we don't need that forward movement, we just need the retraction.
Uh-huh.
Retraction isn't always the answer though, because sometimes you'll just retract at the top and this part isn't going to move like I talked about before. So if we just retract the top, sometimes that's not enough and we still have to address this part of the spine here.
Uh-huh.
Along with what Bridget said, I've done a little bit of work in the nursing homes here and there, and you don't meet too many patients in the hallway with their heads stuck like this.
No.
They're stuck, and then literally I have seen some older patients and their chin is nearly stuck to their chest.
Their head's glued on the front of their
Yes.
chest practically.
Yes,
Right.
and then those bones have fused and it's very difficult to undo.
It's sad.
Sometimes those people come in and we can help them some, but like Bridget said, get in early and figure out how is my range of motion. And,
Right.
maybe you do have a problem that's very preventable to having long-term pain. So another exercise that often we will give is retraction and then with extension, bringing the head up. Along with that, sometimes we'll do a little wiggle back and forth and then bringing the head back. We don't just throw these exercises out though and say, oh, everybody needs these exercises. We of course do an evaluation and see what decreases your pain, if the exercise we do causes more pain in the arms, well, we definitely don't do that
Sure.
exercise. So it's a couple simple things or a good self-check on yourself. Can you retract and can you bring your head up?
Mhm. Are there some preventative things that people can do in order to avoid some of these common problems?
Yes, I think one of the big things that has caught in fire recently is foam rollers.
She is from Carlinville.
Caught fire, sorry. Easy. Okay. A foam roller, lay on the ground. Okay. Yes, and Bridget, I want you to go ahead and roll your thoracic spine. Let's roll first.
Okay.
This is a great way to undo what we do every day to our posture.
I love foam rollers. I think everybody should have this cheap piece of equipment because you can do so much with it.
Yes, you can.
So you can do it like this, or you can do it like this. This would be the incorrect way to do it, but actually getting a little bit of that chin tuck.
So you want
Chin
gravity
retraction.
to kind of help you here. Realign the cervical spine, get your head back a little bit, neutral position, and your elbows are retracted like she's doing. You don't want to contract your abs and draw your rib cage down. towards
No,
your
we want
pelvis.
to let the body open up, and it's going to roll. How I talked about sometimes the ribs will get stiff or that thoracic spine, and that really lets all of that
What causes rib stiffness? People doing too many crunches, I think sometimes. is a
Sometimes,
problem.
definitely. So now Bridget has changed the roller to going vertically down her spine.
Okay.
And this is really focusing on opening up the pecs.
What is she doing here with her lumbar spine? What are you looking for in her cervical spine? What's going on here?
Her cervical spine, I want her head to rest comfortably, so her head isn't way up or down. And then lumbar spine, comfort, but often a posterior pelvic tilt. We'll have her
Which is what?
where she flattens that back.
Okay. So close the gap in the lower back. Great.
Because as people lift their arms up here, if they're stiff and tight,
Sure.
they're going to go into this where they arch their back,
Right.
which then is going to conversely lead to low back problems.
Right. And the other part with the pecs, there's two parts to the pec.
Sure.
Pec major really has 3 different fibers, but then there's another small muscle in there called pec minor, and it really pulls that shoulder forward.
Right.
And there's, lots of us have a forward shoulder.
Let me ask you this. Can you also hold, say, a light pair of dumbbells, 2-3 pound dumbbells if you wanted to? If a person is maybe a couple inches short of the ground
Yes.
in this touchdown position, so to speak, can they use something to
Yes.
facilitate that stretch?
Yes, to put a dumbbell up there is great, as long as, once again, we don't get any further pain down the arms
Okay.
or anything like that. Yes. Okay.
And what's normal as far as a pain threshold? What's abnormal? How do you define that? That's a tricky question.
That is a tricky question. We want people to stretch to the point that you're feeling a stretch, but not pain, not
Okay.
excruciating pain. That gentle stretch is fine. And generally when you're done, if you're sore for 10 seconds after, 10 minutes after is even okay, but if it goes on for days, then we've probably done too much.
Okay.
And if you're experiencing pain in your neck or in your upper thoracic spine
Right.
region for more than half the day, that is abnormal, I would say.
Right, right.
I mean, I think oftentimes we'll wake up and we'll feel stiff, and that's normal as you get older and as
Right.
you're aging, but I think that if you're experiencing it throughout the day with everything that you do, that's abnormal.
That's abnormal. Okay. So we've kind of gone over some basic corrective exercises. If they would actually come, let's say some of these home preventative exercises that they try to do on their own really doesn't seem to be doing the trick. They could come see someone like you, you're physiotherapy professionals, or seek out another physical therapist. But some of the things that you might do to correct that manual therapy, hands-on therapy. And a lot of people, don't understand oftentimes that a physical therapist actually does manipulate sometimes and or puts their hands on the body and physically tries to correct things. Talk about that real
Well,
quick.
if Leah lies down on her stomach, I'll show you real quick the kind of thing that, especially the training that I was taught, and then also one of our business colleagues, Maitland training, because the neck is usually what we're trying to do when we're working in here is get these joints moving. So mobilize the joints. We're not necessarily manipulating the joints, but we're mobilizing so that each of the joints moves against each other so that we can make sure that the full range of motion comes back. And generally when somebody gets full range of motion, they have less pain.
Right.
And that is our goal, as well as obviously strengthening. So just mobilizing the joints like this, or having her roll over and do traction on her back, traction in her spine will also help. How does that ring?
She's going to go to sleep.
Yeah. So we do a lot, and it's gentler than what I would say a chiropractor would do. Although we do some what we call grade 5 mobilizations, which are manipulations.
Right.
So.
Right. There's some carryover there. Okay. Guys, I've learned a ton about the neck and pain and how to correct it. So we're going to take a break. When we come back, we're going to discuss balance. So stay tuned. Hello and welcome back to Personal Health and Fitness. Again, I'm your host, Chad Marshik. Our show today is at physiotherapy professionals, and during our first segment we met with Leah and my good friend Bridget Cutler talking about neck pain. During this segment we're going to discuss balance. Kirsten Transu is the guest for this portion of the program. We're going to talk about balance. You are also an orthopedic certified specialist, not only a physical therapist. What is an orthopedic certified specialist?
The American Physical Therapy Association has board-certified therapists in orthopedics and neurology and pediatrics, and it's a national exam that you have to sit for. It takes about a year of preparation to get ready for it, and you have to have somewhere around 3 to 5 years of clinical experience in orthopedics before you can even sit for it.
Right. So in essence, you have a lot of experience.
Yeah.
A good training. Balance. I've been doing this show for over 10 years, and I've talked about balance in the past, and I think that most people don't understand the significance of balance and how important it is for development. Maintaining good agility, balance throughout one's life is so important. And we're going to talk about that right now. We've got some tools here. Tell me about what you think.
Well, balance is one of those skills. It's a use it or lose it skill, a lot like muscle strength. If you don't train your balance, you tend to lose it, especially as you age and your lifestyle becomes more sedentary. Your balance tends to decrease as a result of that. Also, if you've had anything going on medically, it can affect your balance. Even a 14-year-old who has to have ACL reconstruction on their knee who plays soccer, their balance is going to be disrupted after that surgery because their knee has been messed with, basically.
Right.
Any lower extremity surgery can affect your proprioception, which is a big piece of balance, and that's a big word, proprioception. What it means is your body's understanding of its place in space.
Right.
So where your feet are, where your knees are at any time, which helps your balance a lot. And balance, in the big picture, there's 3 systems, body systems, that tend to influence balance. It's your inner ear, your vision, and your proprioception.
Okay.
Now, we don't do anything with your vision. You got to see someone else for that.
Right.
But and we do sometimes do some inner ear vestibular training if need be, especially if people have some mild issues going on in their inner ear. We can do that, but what we do a ton of is retraining the proprioceptive system.
Okay.
And it is really responsive to training. So anyone from the age of teen who's had an injury all the way up to your treated 90-year-olds before who've had balance issues. A lot of times coming out of a hospital, long hospital stay, they're so debilitated, their balance is so weak that they can really make a lot of progress training it, not just training muscle strength and other kinds of exercises, but specific balance exercises.
A lot of people as they get older have balance challenges. I know my grandmother's almost 91, and she has a few issues. She's had some orthopedic issues, like you mentioned in the past, that can affect that. But I think that older individuals think that losing one's balance is just a byproduct of getting older. And that's not always true.
Right.
Can you talk about that?
Right. You do have a slight decrease in balance as you age. You probably can't, as an 80-year-old, you can't be as sure-footed as a 20-year-old typically.
Sure.
But you certainly can do a lot to prevent a significant loss of balance. You can do a lot of training. And I think also a lot of people in their 60s, 70s, 80s think, my balance isn't good, I'll just have to use a cane or a walker, or they hate the thought of using a cane or a walker, don't use it, put themselves more at risk.
Right.
And then they don't want to leave their house because they're nervous that they have to cross a gravel driveway or step off of a curb. So their life becomes more and more constricted as they worry about negotiating different surfaces outside. It doesn't need to be. There's a lot that can be done in a safe way.
Okay. Let's talk about that. Let's give some examples to the viewers and show them a few things. What do we have here?
Okay, well, we have a ton of toys for balance work, which I love playing with. But I'm going to first start with the really simple stuff because we don't expect people to have these kind of things at home.
Right.
In the clinic, we use them a lot. There's a lot you can do at home without any equipment. Depending on where the person is, if they're a younger person who's already got basic balance, but they need really high level agility to play soccer or baseball or something, then we're going to do some jumping exercises and work on a trampoline and go crazy a little bit. And someone who's 70, 80 years old who is really afraid to leave their house, doesn't want to even go grocery shopping because they're afraid of a fall, we'll do some simple things first. Practice rising from sit to stand without the use of hands. A lot of people lose that ability just to go from a seated position to a standing position without pushing with their hands, and then they feel unsteady. Once that feels good to them and they're able to do that, we do other things like just standing on one foot. And often it's standing on one foot with fingertip support,
Okay.
but quickly we want to lose that fingertip support because you don't want to rely,
Right.
you want to retrain the proprioceptus in your lower legs, not in your fingertips.
And let me ask you this, a lot of, talking about proprioception and but loss of muscle strength,
Mm-hmm.
that can also affect your proprioceptors too, correct?
Right.
Okay?
Right.
And so not only, people think, well, I just have to do balance exercises, sometimes you have to do specific corrective strengthening exercises as well.
Right. And like that's what
They kind of overlap in
Right,
a
the
sense.
sit-to-stand exercise really is a
Right.
strengthening exercise, mixing in with some balance.
Right.
Right, and then when people get comfortable standing on one leg, remember I said earlier that vision is a big contributor to your balance.
Right.
If we eliminate the visual system, then their proprioceptive system is challenged
Right.
even more, so then we do
Exactly.
balance with eyes closed, one leg with eyes closed.
Or maybe you'll have them stand on one foot and then look left, right, or up and
Mhm.
down, or
Mhm.
point at something, and a lot of different tricks to the
Right.
trade, so to speak.
Correct. And then once we get beyond that, we can start using some of the toys we have.
So let's say, I'm going to give you a hypothetical situation here. If I'm an 82-year-old male, I've got some issues related to balance. I know ideally you'd want to see somebody, but what are some of the, maybe some simple preventative things? Maybe give me 3 exercises that an individual could do on a relatively consistent basis to kind of help keep their balance in check, so to speak.
Mm-hmm. One of the things is practice sit to stand without using your hands.
Okay, so I
And
would
if
want to
you-
do something
Mm-hmm.
as simple as, say, grab a chair,
Mm-hmm.
use this plyo box.
Yep.
I'm going to sit here
And just
Okay.
sit to stand
without
without
pushing
using
up.
hands. Right.
And a lot of people
And
can't
back
do
down.
that.
A lot can't.
Right? So even positioning my feet, I want my heels essentially what?
Back under you, and I always say nose over toes.
Nose over toes.
Yep, to come up.
Because so many people, they end up doing this stuff.
Right. They they're frightened. Right.
Right.
Mm-hmm.
Instead of, right. So
Right.
nose over toes, lean forward,
Mhm.
push through the heels.
Right. And if someone's really nervous about doing that, I tell them
Right.
to put a tall back chair in front of them. So they have
Okay.
something to grab onto if
Right.
they feel like they're going to lose their
Right.
balance.
Right. So maybe a series of, say, 10 repetitions.
10 repetitions.
Once or twice a day?
Exactly, once or twice
Right.
a day. It would be
Right.
wonderful.
So that's a basic one. What's another one?
Another great one is standing on one foot when you're in the bathroom. So you
Just in the
have the
bathroom?
sink in front of you. If
Right.
you need to hold on, you
Right.
can.
Trying to keep your hips pretty much
Hips
level.
So, and then if you get comfortable and you feel like you don't have to hold on, I say whenever you're brushing your teeth, stand on one foot.
Oh, great.
And you can-
So you maybe want to do that, what, 30 seconds?
Your goal is to stand on one foot for 30 seconds.
Great.
Right, and if that becomes easy, and then you can even add in with the eyes closed. But
Right.
of course, you always want to do everything in a very safe manner.
So those are 2 really basic
Mhm.
exercises for
Mhm.
somebody that's older that they could do, don't have any special equipment concerns.
Right.
All right, let's say I'm an individual here that maybe that might need to use some of these tools. Let's give
Okay.
people an idea here.
All right. So if someone wants to practice stepping up a curb and maybe on a grassy surface
Okay.
or stepping up mounds, this aero mat is great. It's just a foam pad, and there are a lot of people who are very nervous stepping up on curbs. They have to hold on to
Right.
someone or something. But you should be able to, especially this is what, about 4 inches or so,
Right.
you should be able to independently step up on a surface like that. So that's something we practice a lot.
I think we use it. Eric's pad at our studio. Aeromat, Eric's pad, both essentially the same.
So step up, and you can see it's a little unsteady, so it's a little bit like standing on a grassy surface.
Right.
And step down. And we can practice that. We can practice it straight forward, and we can practice side to side. And we, initially when someone comes in, if they're very nervous, I hold on to them.
Okay.
I don't expect anyone to. We always
Sure.
are very safe in the clinic. And then you can do drills with this when people get more comfortable, standing on one leg, ball tossing, so you get a little upper body
Right,
perturbations, which makes you work harder in your lower leg.
right, great.
So that's
Great
one
tool.
tool. These balance steps we just got into the clinic. They're a lot of fun, and you can do anything you can think of with them. One thing I do with my more basic balance patients is just use them as cones to step over.
Okay.
So just have them practice stepping over the
Have an
cones.
obstacle
Have an
course.
obstacle course. That's another thing people can do at home. I've had patients actually save all their empty Coke cans or soda bottles or water
Right.
bottles and line them up in their hallway. In a hallway where they have a wall near them,
That's
maybe,
great.
and they can practice stepping
That's
over
great.
them. As you get better, you can walk along them.
So they've got a
Therefore,
little give and a little bite to them, so you're not going to slip off necessarily.
Right.
Right.
Mhm.
I like that obstacle course because so many people as they age tend to walk kind of on a tightrope and their stride is really short. So making them stride out a little bit is going to stretch some of the muscles that they need to stretch through their hips as
Right.
well and strengthen different areas. So that's great.
Right.
Even sideways, crossing
Right,
your
they
feet,
do a lot of side
all
stepping
kinds of
too.
different patterns
Mhm.
you could do with those. Definitely.
And then another tool we have are these little cushions. And these, most clubs have these
It's
too.
a Dynadisc,
Mm-hmm.
right?
Yep, and you can do that. You can stand on these with both feet.
So it's like a blow-up pillow.
Mm-hmm. And or you can try standing on with one foot.
Mhm.
This is hard. So this would be the higher level athlete type person standing on one foot doing
Right.
some ball toss. You can do squats on it. There's a whole. You can be as creative as
Just
you
a
want.
myriad of different exercises you could do, right? As far as, all these different tools that we have at our disposal, even doing simple exercises, I know that we encounter a lot of young athletes. The only thing they've ever done, for example, is a deadlift and a squat. We get a lot of high school athletes that come see us. But then when I throw them on doing a single leg squat with no weight, they can't do it oftentimes. Is that necessarily a balance issue, or what is that?
That often is a big balance issue. Balance and core strength, that's kind of been a big hit word lately, or thing people
Sure.
focus on, core stabilization. That is really important, and that is a piece of balance, especially for the higher level athlete.
Okay. I think that's something that people need to definitely do. Not just do, bilateral exercise. They've got to do the single leg movement patterns because, especially in sport and everyday life, oftentimes you're only on one leg.
Right.
When you run, you're only on one leg for a split second. When you jump, oftentimes for maybe to catch a pass in football or you're playing volleyball and you have to lunge, you're oftentimes only on one leg. So just by training always with two legs in contact with the ground, it's not always going to address every need that you're going to have out there on the playing field in everyday life.
Right. I think one great thing for athletes like that who are doing it is standing on one of these with one leg. If they ever do bicep curls or tricep extensions, do
Right.
it on the disc on one leg.
It really makes your hip stabilizers
Mhm.
and you're having to recruit those muscle fibers deep in the core musculature,
Right.
pelvic floor. So,
Mhm.
Kirsten, I really appreciate you helping me out today.
Thank you.
It was a
Thank you very much.
Good program on balance. If you have any questions on anything that we've discussed here, please call physiotherapy professionals. You can check out their website. The number will appear here in just a moment. So check them out. They've got a lot of great things that they do here, and I really think they're quite credible. So thanks again for joining me on another edition of Personal Health and Fitness. Until next time, I'm your host, Chad Marshik. Hey, Quinn and Riley.